Good morning, everyone. I would like to call the January 18th, 2022 Sherburne County Commissioner County Board meeting to order, and we'll begin with a moment of silence and a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, would anyone like to move for approval of the agenda with, yes?
Madam Chair, members of the Commission, after looking at the order and the changes that happened with the Supreme Court, staff would suggest a change in the order, starting on the second page. After item 5.4, if the board would be willing to go into Community Health Board meeting, we can get an update from Nicole prior to taking on items 6.4, my apologies, item 6.4, doing 6.5 and 6.6 after the Community Health Board meeting. That way we would get the update on what's happening before discussing the Centra Care request and the now defunct ETS.
So we would have the open Community Health Board meeting after item 4?
After item 6.4, correct.
6.4, right, okay.
So we are moving item 8.1.
We would do all of item 8 after item 6.4. 8 has 3 items.
Item 8, 1, 2, and 3.
Correct. We would do those and then return back to the regular agendas for 6.5 and 6.6.
I'll move the agenda as amended.
I'll second.
Motion's been made and seconded. Any other discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion passed. Okay, moving on to the consent agenda.
Madam Chair, I'll move the consent agenda as presented.
Okay, is there a second?
I'll second.
Motion has been made and seconded to approve the consent agenda. Any discussion on that? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion passed. Now we can move on to open forum. Do we have anyone for open forum?
Yes, we do, Board Chair. We have Terry Dickinson from Big Lake to speak on the election systems.
And when you come up, just please introduce yourself and let us know where you're from. And
Hi, I'm Terry Dickinson. I'm here just to give you some information on some of the election systems because it's a concern of mine personally. And I'm just going to read part of the state statute. It's a subdivision 3. When applicable, the county auditor or municipal court clerk must immediately record that a voter's absentee ballot has been accepted. After the close of business on the 7th day before the elections, a voter whose record indicates that an absentee ballot has been accepted must not be permitted to cast another ballot at the election. In a state primary, general, or state special election for federal or state office, the auditor or clerk must also record this information in the statewide voter registration system. Good morning, Commissioners, and thank you for the opportunity to provide you some information. Like I said, this is a concern of mine. I have spoken with Sheriff Brott, who did his due diligence in investigating the evidence, and Auditor Diane Arnold and County Attorney Kathleen Haney. We have definitive evidence that at least 2 people voted more than once in our 2020 election, but the county is unwilling to prosecute. My concern, however, is this proves that the process and the KNOIC poll pads do not work as advertised, nor do our internal process work to prevent duplicate voting, as we have confirmed that it does not prevent voting from post office boxes or UPS store boxes either. I highlighted two. We did submit 11 votes cast by people who had died before the election, 2 who voted out of post office boxes, 4 who voted out of the UPS store, and 4 who were possible duplicate voters. The other 2 duplicate voters were discovered to have been separate voters that were accidentally merged or mistakenly merged by employees of one county or the other. But thank goodness to the inquiry that they made, because we turned in names, those individuals have been restored to individual counts. And I just want to give you information, and we'll be back and to follow up on more of the information, and thank you for your time.
Thank you for your time. Is there anyone else? Okay, so then we'll close our open forum. And we'll move on to announcements.
Thank you, Madam Chair, members of the commission. Just a few quick announcements for you. I did pass out for your discussion under item 6.5. We did get an update from the Greater St. Cloud Development Corporation, so that is a hard copy there for when you have the discussion of Centricare. A couple other things real quick. Just in polling the board, I had that nobody is at this point planning to attend NACO. So at this point, we will be canceling hotel rooms and flight reservations. Whether there's a hybrid option or not, I'll communicate that to you at the time. But just making that notice, so we will not notice a special meeting for the trip out there. Next, just a note that we did receive a request for consideration of conduit bonds for guardian angels. So pursuant to the board policy, we will be bringing forward a request for consideration of issuing conduit bonds for guardian angels. We are going to recommend a waiver to policy. The policy currently says that we don't consider conduit bonds until April. Guardian angels would like to have those issued at the very end of February, just because of their project timeline. In discussing this with Dan and the attorney and the auditor treasurer, we don't envision at this point any other bond issuances for that month gap, basically March, that would prohibit you from considering their application. So we will be bringing that forward in February. Next, just wanted to note we did receive a notice from the Department of Human Services that they've accepted the audit that was completed for 2020 fiscal year, which is good news. So once we can complete all our compliance there, we'll have the department, our department will be in the clear. And then last but not least, some great news. We did receive notice on the 14th that our jail has earned healthcare accreditation from the National Commission on Correctional Healthcare. So congratulations to Sheriff and the jail staff for not only passing with flying colors, but receiving full accreditation.
Thank you.
Chair,
Yes.
I just have a couple of things for information.
Okay.
You know, I'm in and out my desk a little bit, going through some stuff, and I found a couple of things that I thought would be of interest. First of all, the North Star Commuter Rail Phase 2 study. I have both copies of that, and I guess I would like them back, but I will share them if anyone wants to read and understand what the thinking was when Kimley Horn did the study back then, indicated it wasn't. And then I also have from 2003 from Decision Resources. We spent quite a bit of money at that time polling people who lived in Sherburne County and getting information on how they liked their parks and what they wanted for parks. Now, I know it maybe isn't timely anymore, but I think it's a very interesting read. And when we start talking about trails back then, even then, trails were a big thing as far as park users, and that may still be the case today. But anyway, this you can make some copies of, and I'd like this back as well. So that's all. Thank you.
Well, thank you very much. I think both of those sound interesting, so I like history, knowing background. Thank you. So is there anyone else with announcements? Seeing none, can go forward and we will recess our regular meeting and open the Regional Rail Authority meeting. And we'll start with approval of agenda.
I'll move approval.
Motion's been made to approve the agenda. Is there a second?
I'll second.
Any discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion passed. So now we can move on to item number 2, which is review and approval of the Regional Rail Authority meeting minutes from January 4th, and I think you have them in front of you.
I'll move approval.
Okay, we have a motion to approve the minutes on January 4th. Is there a second?
I'll second.
Second has been made to approve the minutes. Any further discussion?
Madam Chair, just to be clear, this is the hard copy, not the copy in the public packet. The public packet had some errors in it, so this is the new hard copy that got passed out.
Oh, okay. So the version that we have is that, do we need to identify which version we're approving
If the maker and the second are okay, we can just do as corrected.
as corrected, if that's okay? with the-
Lisa?
Sure, I haven't seen that hard copy though, so
It's,
I will
Right.
rescind my motion if someone else has viewed it.
I'll
I
go-
feel more comfortable with that.
Madam Chair, I'll make the motion to approve the meeting minutes as presented to the board in hard copy this morning with the, yep, all right. this
It's a
is-
corrected title.
Okay, yep, with the corrected title as well.
okay, motion's been made to approve the minutes as corrected. Is there a second?
I'll second.
Okay, motion has been seconded. Any further discussion? I'm glad you brought that up. Seeing none, all those in favor, say aye to approve the corrected agenda
Aye.
minutes.
Aye.
All those, okay, in favor, say, all those opposed, nay. Seeing none, then the minutes are approved as corrected. Okay, now we can move on to number 3, which is consider the second amended and restated contribution agreement with ACCRA and payment for option 1.
Good morning, Madam Chairman and Commissioners. Back in December of 2021, we had presented to you a number of options and stuff going forth with Anoka County Regional Rail doing a refunding on this bond. So it was brought up to us that we had an option that we would be able to select and to be able to pay off our portion of those bonding payments that were our responsibility. And they have brought forth the amended second agreement, state and contribution agreement. Our county attorney has reviewed this and there are some updates and stuff in there. So this is the final draft. And once this does get approved here, this will be coming through DocuSign and for the signatures, and it'll be coming from Anoka County Regional Rail. Their county Regional Rail has already approved of the refunding of the bond payments on here. Are there any questions?
Mr. Chair, I'll move approval.
Okay, motion has been made to approve this item to consider the second amended and restated contribution agreement with, how do you pronounce that acronym? ACRA and payment for option 1. Is there a second?
I'll second, Madam Chair.
Motion's been made and seconded. Is there any further discussion?
Madam Chair.
Yes,
Where is Anoka County Regional Rail Authority?
okay.
Yes, this is the Regional Rail Authority portion of it, and then you'll have to do the county board portion of it next.
Mhm. Okay, any other discussion? Seeing none, all those in favor say aye.
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 Those opposed, nay. Motion's passed. So then we will close. Are we done? Okay. We will close the Regional Rail Authority meeting and reconvene our regular agenda. And item 6.1 is to consider the recommendation of the Sherburne County Regional Rail Authority on signing of the second amended and restated contribution agreement and early repayment of its share of Anoka County Regional Rail Authority issued bonds.
Thank you, Madam Chair and Commissioners. This is now being presented back to our regular county board for approval. Our final payoff amount on this was $3,888,092.95, which is lower than the original estimated amount by $12,654.81. That resulted in estimated savings for Sherburne County Regional Rail Authority of $474,492.98. By us paying this off earlier, we're going to be saving that much money.
That's great. I will move approval.
Motion's been made to approve this proposal. Is there a second?
I'll second, Madam Chair.
Okay, motion's been made and seconded to approve and accept the recommendation of the Sherburne County RRA and approve the second amended and restated contribution agreement and early payment to Anoka County Regional Rail Authority bonds as indicated in Exhibit A.
Madam Chair,
Yes.
I just want to comment, it's clear, I mean, what we are doing here is we are basically refinancing an obligation that we have undertaken, and we have other, anything we would do other than this would put at risk our bond rate, so this is what we need to do.
Thank you for clarifying. Any other discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion passed.
Thank you, Madam Chair.
So we can move on to item number 2, which is to meet and welcome the new Child and Family Social Services Manager. Amanda.
Morning, Commissioners. Today I'm pleased to introduce you to Meg Caribou. She is our new Social Service Manager for Children and Family Programs. She is replacing Jody Hirung in that position. I think you all know that Jody is still with the agency, but taken a less demanding role. And so you'll likely see Meg at upcoming board meetings. And just to, again, remind you, under that division, Meg will be responsible for our licensing and intake unit, children's mental health, child protection, and then child welfare, which is ongoing case management. So,
Welcome.
Thank you. Good morning. I come to Sherburne via Hennepin County, Anoka County, Carver, and Meeker County, and have worked in child welfare in one capacity or another for 20 years and have supervised mostly in ongoing child protection. So I'm excited to be here.
Welcome.
Great.
Welcome, we're happy to have you.
Happy to have you as well.
Thank you.
I think you finally arrived at the right spot.
Nirvana.
Took you 20 years, but you got it
Yes.
figured out.
Okay, now we can move on to item 6.3, which is to review and approve the US 169 and CASHA for interchange design contract. And we have Andrew.
Morning, Madam Chair, County Commissioners. I'm excited to be up here this morning to put in front of the County Board the opportunity to approve the agreement with Bolton and Mink, the contract with Bolton and Mink for design services of 169 and County Road 4 in Zimmerman for the interchange, the Zimmerman interchange. You can see we had 3 proposals. One minor correction, we did send out invitations to 5 consulting firms, which is different than what it states in the packet. One of the firms opted not to propose, and then 2 of the other firms opted to team up together. So you'll see the 3 proposals there. Even with the detailed request for proposals that goes out, you still need to make some adjustments to make sure that you're comparing them apples to apples. There's some optional services that were included in some and not in others. So you can see the summary of that below in the background and justification. A couple of key items to note. The schedule with this one is maybe a little bit more aggressive than some of the other ones, but still maybe not quick enough. So we're gonna continue to work as hard as we can to move this forward as quick as possible. We've identified right-of-way limits or property limits, if you will, for November of 2022, which would then allow us to start getting into the property acquisition phase of the project as well. Concurrently, we'll continue working on final plans and look for completion in and around late summer, early fall of 2023. This will allow us to get back out to the public to provide ample public input on a number of different options that will likely be discovered as we start digging back into this and getting into the environmental process as well. So with that, we would propose Bolton and Mink as our preferred consultant for the design of interchange in Zimmerman on County Road 4 and 169.
Okay. Would anyone like to make a motion to approve a contract with Bolton and Mink for the Zimmerman interchange design for 169 on County Road?
I'll move approval.
Is there a second?
I'll second, Madam Chair.
Is there any discussion?
I just have a couple quick questions. Now, the design is not, I mean, we're seeing design options when we look at these things, or is this design that's on the front sheet of the proposal, is that the, because I like the looks of it, I'm not saying that, but you're just beginning with the fleshing it out, or?
Yeah, I appreciate that comment, Commissioner Schmeezing, thank you. That's just one concept. It hasn't been vetted. It hasn't been through any engineering studies. It hasn't been through really anything. It's just a concept. Something that looks nice on the cover of the proposal really is what it comes down to. But we're going to be going through a number of options and alternatives and bringing it out to the public for comments.
So as we go through this, we would be hopeful that by the end of 2023, we would be saying this is what we're going to build there?
Correct. I would even say and maybe state that by the end of 2022, we're going to have a very good idea of what we're going to build, just not the final details of it all.
Thank you.
Mm-hmm.
Chair, I want to thank our staff on this. This has been a quicker process, like Andrew stated, than what we typically are used to. But with the timing of all that's happening in Elk River, it just seems like it made sense to get on this, and with the opportunities we have currently on the federal and state level with some access or opportunities for funding. So I appreciate the expedited work on this and the shortened timeline that was in the packet. So,
thank you.
Any other discussion or comments? Seeing none, all those in favor of approving this motion, say aye.
Aye.
Those opposed, nay. Motion's passed.
Thank you.
Exciting times.
Yes.
I found the project schedule here. Checking off that list.
Okay, now we can move on to item 6A. Consider the American Rescue Plan update and recommended approvals and expenditures. Dan Weber, hi.
Good morning, Commissioners. This week we have 3 approvals that total $80,928 of our biweekly expenses, and I'd be looking for a motion to approve.
So, could we get a motion to approve you want to do these separately?
Nope, all together.
They're both together?
Well, there's 2 items on here. The first is the expenses. That would be separate from the community support program. We'll do that next.
Move approval.
Is there a second?
I'll second.
Motion's been made and seconded to approve the expenses. And any discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion's passed.
And the second item, if you recall, we had a community recovery program for nonprofits that lost more than 20% in revenue, and we did have 3 that qualified, and the list was included in your packet. So I'd be looking for approval of those 3. We did dedicate over 500,000 to the program, and you can see we only had 60,000 that was awarded, so that would be 440 will be put back into the ARPA pool. And I know we have a discussion on the second phase of the community support program at our workshop later today.
Okay.
Madam Chair, I'll make a motion to approve.
A motion has been made to approve the Community Resource Recovery Grant. Is there a second?
I'll second.
Motion's been made and seconded. Any further discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion passed.
Thank you.
Okay.
So at this time, if the board is amenable, then you would recess the regular agenda and go into the Community Health Board meeting.
Yes. Now we will recess our regular meeting and go into the Community Health Board meeting. Hello, Nicole. Thank you.
Good morning, Commissioners, Madam Chair. And Keisha, I did add a PowerPoint this morning as well.
We need to approve the agenda and minutes first.
Okay.
Madam Chair, I'll move the proposed
Okay.
agenda.
I'll second.
Motion made and seconded to approve the agenda. Any discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion is passed. And now we should review and approve the minutes for the Community Health Board meeting on November 16th.
Madam Chair, I'll move approval.
Motion's been made. Is there a second?
I'll second. Oh. I'll second, Madam Chair.
Okay. Motion's been made and seconded to approve the meeting minutes from November 16th. Any discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion is passed. So now we can receive the administrator's bi-monthly report. Hi, Nicole.
Morning. That? I think there's a different one in there, Keisha, I'm sorry. That one's December 17th. That is not the correct one. Can you go to, nope. Can I access the H drive for public health from here? Can you access that? You don't have your computer with you, do you? I'm sorry. It was a late edition. I had some additional things to add this morning. I can give you a quick verbal update before we get to the COVID, because I think that has probably the most content. But for the Public Health Division, I just wanted to do a quick update on staffing. Peggy Salmons is our new public health planner, and she has been in place since early December, and she's also been assisting with HR COVID-related absences. So she's been off to a busy start, but we're really glad that she's here. And she is coming from Stearns County and has about 20 years of experience in the public health, public sector as well. And then I also wanted to mention that the Department of Health has also released some information about a new funding opportunity for local public health. This is the second one again in a short time, but this one's called the Public Health Infrastructure Grant. It is a short-term project-based grant for a 2-year kind of period, which has funding to be extended beyond that. It is in the base funding and was passed this last legislative session, but has been taking some time to kind of figure out what this looks like. It originally had been called an innovative grant, and we're still exploring what that might look like for us, or if that's something that we're interested in putting a project forth. So still more details to come on that. And then just a few updates from our health promotions and public health units. Last week and this week, we are finishing up our WIC management evaluation. That's an every 2-year process with the Department of Health. And we should have those summaries by the end of the week about how well we're doing utilizing our WIC program here in Sherburne. Our SHIP mini grants have also been available to the community, and I believe those applications are in and will be discussed and awarded soon. So stay tuned for some of those activities. We've had some increases in public health nuisance reports, and so I just wanted to make you aware that we have been doing those investigations in partnership with Adult Protection for the most part, and are working on some solutions to help those areas in our community. And then lastly, family home visiting is also expecting a large RFP this spring. This RFP is very similar to one we've gotten about 5 years ago for our First Steps collaboration, and we'll be looking at refunding that collaboration with the funds and RFP this spring. Those wouldn't start until 2023 and would be a 5-year grant, much like we've received.
Nicole, is it possible, this is titled 118, but is it possible you didn't update the date?
No.
Okay.
Sorry, technical difficulty.
Well, since we've got a little time, did you hear the one?
I'm sorry for the delay. I can quickly breeze through. I just did a few highlights for 2021 in our COVID work. We held 154 vaccine clinics. That was both on our campus here and out in the community. We administered 17,359 vaccines. We had almost 500 doses of the vaccine that was given from the bus, so certainly made good use of that. We delivered about 70 essential services to community members. Mostly that consisted, that's it, thank you, sorry about that, consisted of food box from CARE as well as non-perishable food that were needed by the family, diapers, formula, medication, really whatever they needed to help them stay home and be isolated during their infectious period. We assisted with testing as requested, and we did a lot of messaging and communication with partners and data analysis. I'll scoot through these. All right, so the nuts and bolts of our COVID information. So I wanted to start with just some situational awareness. The data I have is the data I have, and it is only as good as what we can get at this point. So there are more cases out there than what we know. We estimate that there's 3 to 5 times more than what's being reported every day. That is due in part to at-home testing. That is not reported to the Department of Health or to us. So we only know those that have been reported. We do know that people aren't able to access testing, don't want to get tested, or unaware that they should get tested. So that's another bulk of kind of where our testing rates are. And then just to know too that the volume of tests that are coming through our labs, there are backlogs. So at times you may see large case numbers rise just due to the testing and how they're able to process those. They're estimating there's about 15,000 cases a day, and that's not including those tests at home. Omicron has also changed the game for us in the last few months. We've seen school districts move to distance learning, and not just because they're fearful of the infection, but because staffing has really been the issue. Students have been absent, bus drivers are absent, people have had to stay home to care for dependents. So that's one scenario there. We've also seen local businesses having to decrease hours, having to shift duties to other folks because they are also experiencing some staffing shortages. Omicron is doubling quickly, so every 1.5 to 3 days they're seeing it double. We know that the monoclonal antibody therapy is less effective against this strain, and we're also seeing that those antivirals are in short supply, and so the hospitals are really divvying those out on as needed basis. We know that people who have had 2 shots and their boosters are 25% more protected from Omicron infections. Local public health in the last few weeks has received over-the-counter tests, and we've been sharing those with community members that have had a hard time accessing testing, and also with partners who have access to folks who may be coming in. So CARE, for instance, took a variety of tests and are dispersing them at their site.
Mm-hmm. Just interrupt you for a second. People with 2 shots and a booster have, it's not 25%, 25 times more.
Protection, yes, I'm sorry.
Yeah, I think that's.
Yes, very much. We've also been pushing out some masks to our local partners. We put an ask out if anyone had a need to let us know, and so deliveries were made last week, and we have more scheduled for this week. We've had some updates from our long-term care partners that they too have had a lot of staffing issues, and the National Guard has been in our central region to help support those nursing homes. They've also offered barrier-free CNA classes, so they've waived fees, they've offered them virtual and shortened the time. So really hoping to have some strategies in place by the end of the month to help with that staffing issue. The federal public health emergency was renewed, and for us specifically in public health, that means our WIC services will remain as is, so we don't require people to come in now for labs or those in-person appointments. And most recently, Minnesota has updated their recommendations for isolation and quarantine to follow the CDC's, and I know that has caused lots of discussions about that shortened time, what it means if you're vaccinated or unvaccinated, and then again, what work setting you work in and how that may apply differently to you. I haven't shown a projection for a really long time, but our partners at CentraCare use this the last couple of weeks just to talk about where we think we're headed. We haven't quite reached the peak of cases yet. They're hoping by the end of this week, early next week, we'll kind of hit that peak. But if you notice, the slow decline down is still a significant amount of cases that we're expecting. And even though Omicron's severity does not seem to be as serious as Delta, just because of the numbers, we're still expecting to see many people in the hospital and out of work. I'll just draw your attention shortly to that little green dotted line there. That is, if 80% of our population wears a mask, that's the projection of how they think we can decrease the case spread.
Madam Chair, in their presentation, it's 80% mask use inside with a
Indoor.
KN95 mask.
I believe that's what it is. I don't know specifics. That's what the recommendation is, though,
In their
correct?
video, they called out that it's 80% usage of the right kind of mask used properly. So.
Right. And then just a little bit on the positivity rate. So last week, CentraCare's positivity rate was 32%. We were about 21%, and we're right in line with the state, about 21%. They'd like to see it under 5. We haven't hit that now for a few months, so hoping to get that. As of January, we have 1,100 cases already here in Sherburne County, so I don't know if we're going to reach that same level as in December, but we're on pace to be at least equal to that.
Madam Chair, another quick question. Can you go back one slide?
Sure.
These positivity rates are based only on our testing locations, not the at-home tests, correct?
Correct.
Got it.
We do not post every day our dashboard updates. We only do those a couple of times a week, so our lines go up and down frequently when you look at the 7-day average and then our daily count. But overall, if you just notice the large gap, since July, we've been increasing, and we just continue to do that. And hopefully we're on that decline now, but you will see some of those ups and downs in there. We've also been in communication with the Department of Health. A few zip codes keep ending up back on our list, and we have to manually remove those, and then the state has to take them out. So you may see at times where there's a very high rate, and then the next day it's decreased. It's because we've shored up those zip codes and reported those and gotten those corrected. Significantly, most of the cases in the last few months have been our 6 to 19-year-olds. We have seen growth in the 0 to 5, but really the most growth has been in those 6 to 19 age range. And then we've got just a little overlay of where we were a year ago in comparison to where we are now, and so we're just starting on this year 3. But certainly orange is our most current number of cases, and we've exceeded cases from our first year to our second year. A quick snippet of how we compare to our partners around our region and around the state. We're still kind of in that upper third here in Sherburne County. We've been in the 900s the last couple of weeks. Prior to that, we had been in about 400. When you look at our school districts independently, they're all around 400 to 500, Elk River being the highest, around 600. And then even broader throughout the state, certainly the metro has seen a drastic increase, and we're just on the cusp of that as well. We're in that 50 to 75 weekly case rate right now. And this does not include the first week and a half of January. This was still at the end of December. And I think significantly, thinking about what we can do and vaccine, this is just some diagrams of the cases based on fully vaccinated or not vaccinated. And so we continue to see that wide gap. Again, this is also very delayed. This is from mid-November. We don't have updated information as to what it looks like today, but as we can project, we would assume that that gap continues at least at the rate it is here. Hospitalizations look very similar. We saw, hospitalizations early on in the spring, kind of similar, whether you were vaccinated or not. And now we've really seen the change that if you are vaccinated and fully vaccinated or up to date is the new term. So if you were eligible for a booster and you got one, you're up to date, that has really significantly decreased the need for hospitalization in those who are up to date. And then COVID deaths, the same. So those who have been fully vaccinated experience less death related to COVID versus those who are not.
Well, could I just ask a question about the deaths? Is that total or is, it's per 100,000?
Correct,
So, okay.
the age-adjusted rate.
Okay. For our county or for the state?
State.
Okay.
I do know that I believe I'm pretty close, about 30-some deaths in the last 2 months here in Sherburne County. And that's significant. I think we had averaged, 6 to 8 in even some of our high periods. So certainly saw the death rate increase the last 2 months here in Sherburne. I don't have a lot of details about age or other factors, vaccinated or not, just know that we've experienced increased deaths as well.
Madam Chair, is there some delineation between the Delta and the Omicron variant in terms of testing?
I believe what I heard this last week is about 90% are probably Omicron, but since they don't.
Delta falling off then? Is it coming down?
Yes, so Delta has been decreasing, Omicron has increased. Not quite sure what happens after the spike and we start to decline, if that means all or just more so the Omicron. Overall, for us here in Sherburne County with our vaccination status, we've made increases, so I'm happy to see that. They've been very slow, so even our clinics have had a slower uptick in them. For a little while, we saw some increase in boosters, and that's kind of leveled off now as well. I think the 5 to 11-year-olds, again, has been probably our biggest vaccine clinic drive lately. But again, we do see some in those 12 to 15 and 16 to 18. A few things about what we can do. I know many of you listen to Centricare and have heard from around the state our healthcare providers are struggling with their capacity. So promoting vaccination, including boosters to all those who are eligible. Staying home if you're sick and adhere to the isolation and quarantine recommendations. Support universal masking in all indoor settings. And limit indoor gatherings and contact with people with unknown vaccination or test status. So if you're in a large group and you're not sure if that group has been vaccinated, testing options may be warranted. I don't want to forget to thank all the people who have been really supportive in trying to decrease the spread. People who have gotten vaccines, who have vaccinated their children, who've gotten their boosters, who've worn their masks, and who have avoided large gatherings. Sometimes we really concentrate on the negative, but there are a lot of our community members who are really advocating and doing a great job decreasing the spread. Questions?
I just want to thank you for all the work that you've done, and it's good to hear, that we have had so many vaccinations and clinics, and all of the stuff, and that the bus was, you know, busy with vaccinations too, and that we've been able to accomplish that. That's wonderful. Thank you so much.
You're welcome. I think the bus really provided an opportunity. We parked in a parking lot by an apartment building and people just came out. So really took the barriers away. They didn't have to worry about an appointment. It was very successful, and we hope as soon as the weather warms a little more, we'll be back out on the road again.
Yeah, okay. That's great. Any questions, comments from anyone else? Thank you.
Thank you.
So, Madam Chair, at this time, if the board is ready, we would end the Community Health Board meeting and reconvene the regular agenda.
Yeah, so we are ending the Community Health Board, and we will reconvene the meeting, and we will begin with
Item 6.5.
6.5, which is to consider the Centricare Community Response to Omicron and Joint City-County Statement.
And I'll just do a very brief summary. So 11 days ago, Centricare held an emergency virtual meeting to discuss what Nicole has explained to you is happening in the health industry. Centricare requested that local jurisdictions consider a mask mandate for visitors and employees indoor. On Monday following that, Mayor Kleiss organized a joint statement recommending masking but not mandating masking. As of today, all of the cities, including St. Cloud, have signed it, and Benton and Stearns County have also signed it. So if the board would like to discuss either Centricare's request or the joint statement and authorize Sherburne County to sign it, that would be what item 5 is regarding.
Any thoughts?
Madam Chair, I'll just weigh in. I'd be fine with the joint statement.
And that would just be the joint statement recommending the mask.
Madam Chair, I'm okay with, asking everybody to be smart. I do have a little bit of consternation over the joint statement because the numbers kind of contradict what we just got from our own public health department. I believe and I'm sorry, my computer decided to update in the middle of this, so I don't have it to reference. It's 13% complete, if anyone cares. The positivity rate, I think, in the joint statement, I believe that was St. Cloud Hospital's positivity rate, not our counties. And it just, the verbiage and some of the things that are used in that statement, I struggle with. I don't mind the sentiment of it, but I don't know if we could maybe strip out those and put our own. I mean, it's a joint statement, so.
Well, I mean, the joint statement was issued without our signature. If you want, we could just, with the board's permission, I could write a generic us too and take out the data and just say we support the concept at this point.
I'd be more in favor of that. I have a little bit of trouble voting for something that doesn't go with what we just looked at, so.
Yeah, we can, I mean, again, if the board makes a motion to direct to have a statement put out that follows this, then I'll work with Nicole and get it ready for the board chair signature.
Yeah, I'm fine with that too. We're not mandating anything.
Right.
We're just encouraging. So I'm good with that.
Yeah, we're helping educate and making sure people know what's going on, and asking them to
And they can
be
make
smart.
their own choices.
Yep.
Any other comments? What my concern is that I think we need to encourage positive messages, that it's important for people to wear masks, and I don't know if we want to state what kind of masks, but I know that the recommendation is to wear something other than cloth masks, that there's a variety of medical masks, not just the N95, that are considered appropriate and more helpful than cloth masks. So if we're not going to, my thought is if we're not going to sign the document that's already been written, and we want to make our own document, I think it would be nice for us to encourage people to wear masks indoors for the safety of all people, and that we can, somehow write that up. But
Madam Chair, I guess I'd make a motion to allow administration to work with public health in putting together a statement along with best practices to issue that statement.
motion, okay, so motion's been made. Is there a second to that?
I would second it if it would go through board review first.
And the only way
That
it
would
would,
look like.
and that would be fine, but if it was to go through board review, that would have to be done as part of an open meeting. I mean, we can't just circulate it on email and say, hey, what do you think?
Right. We'd have to call a special meeting, otherwise we wouldn't be able to approve it until 2 weeks from now.
So-
I mean, is there harm in approving it 2 weeks from now?
Do we have a comment from our attorney here?
Madam Chair, Commissioner, I agree with him.
You agree with what?
Felix, with Commissioner Sneezing, sorry.
Okay,
Can we just say the CDC guidelines? I mean, there's a lot of information out there. Encourage people to educate themselves or something of that nature, where we're not really calling out a certain, because there is a lot of information that if you just wear a cloth mask, it helps as well. So I think that's all a person's individual choice. So I want to make sure that we don't get that deep.
Chair?
okay.
So I'm very fine with putting our own data in it, and I'm also very fine with saying wear your mask indoors when you are around others, period. And the 3 bullet points they have: limit interaction with others outside your home and wash your hands. If what we need in it is our own data, I am fine with that. But those 3 are key, and the next 2 weeks are critical. So I think the mask encouragement is needed yesterday, is what I'm hearing from health professionals. If you watch the Center Care video, if you talk to Fairview physicians, if you talk to our public health department, these next 2 to 4 weeks for transmission of the disease, trying to slow things down a little bit so we can give our hospitals a little break. I mean, it is critical right now if you talk to healthcare. So I don't think we can wait 2 weeks for a board meeting to decide this. So I'm fine with our data and those 3 bullet points.
And I was just going to suggest that if we've got the spirit of the board's direction, I think with respect to masking, what we'll do is we'll say masks are recommended and say ideally, if available, but we'll just say masks are recommended. That way we can hit both of your points. To move this forward, though, we'd have to have the seconder withdraw her second and make the second clean to what Commissioner Dolan said originally.
And I'm fine
Where are
with
you
that.
with that? Okay. So now, do we have what was your,
My motion is to direct staff to prepare the statement that Bruce just outlined, including the information that Commissioner Phobie stated as well, to disseminate.
okay, and then would you be okay with that?
I'm fine with seconding that.
Okay, so motion's been made and seconded. I don't know if I can quote that.
You don't need to, we got it.
Okay. Is there any further discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. Motion passed. Thank you so much.
And with respect to item 6.6, if the board is ready, I'll just give a brief update, and Tammy's here to answer any questions, but I'll wait for you to put it on the table.
So, so now we can move on to 6.6, and we're going to consider steps for implementing the Osha regulations.
And with respect, since this was published on Thursday, things obviously changed significantly Thursday night. Staff's recommendation has changed. We would just recommend that there be a motion and a second and then a vote to withdraw, or do you want to say suspend? What would you prefer? Suspend the interim or rescind? Probably rescind, huh? rescind the interim policy, so take it off of our active policy.
Madam Chair, I'll make that motion.
And I'll be happy to second.
Okay, motion has been made and seconded to rescind our previous motion. Is that okay to say it like that?
And then before you vote, just one update for the board.
Okay,
We think we have definitive legal opinion that the second mandate on healthcare workers does not apply to us. That's from our outside counsel. So I just want the board to be aware of that. We do not believe the second opinion, which was upheld on Medicare and Medicaid, will not apply to county staff. However, we are still watching contracts and grant agreements for you. So that's the update. So this will clean the books. We're still watching, and we'll let you know if anything changes.
okay. Any comments?
Chair, and I don't know timing-wise or when this could happen, but just with our colleagues in Stearns and Benton moving to a mask mandate for their government centers, I don't know if that's appropriate to discuss right now. Since this has changed, I think that I know it's awkward, I know it's uncomfortable, I know we're maybe all across the board on it, but I believe that I've had calls from Benton and Stearns County Commissioners asking us to consider it. We share St. Cloud together, our government center. We have chosen as a board to have our government center open to the public, which I have agreed with. If you've watched the CentraCare tape, which Commissioner Dolan posted on Facebook, and talked to other healthcare professionals, it is critical right now. And I think of just, if we're choosing to be open, I think we also somewhat have a responsibility to do what best we can to protect our staff and the public. And if right now I know some of our departments are talking about going with skeleton crew, if our DMV department, for example, was to be wiped out, we'd be out and not be able to support the public for about 10 days. So I just think we're a county that has chosen to continue serving our public, and so want us to have that discussion a bit about a temporary, 2 to 6 week mask consideration for our government center to best respect our employees and the public.
Okay, so just for process, we have passed a motion, we've made a motion in a second to rescind our previous. So should we vote on that and then go to discussing this, or should we amend the motion to
At this point,
but add,
I'm sorry.
should we amend the current motion?
At this point, you're in discussion on the motion, so it's totally appropriate to have the discussion.
Yeah,
If Commissioner Philby feels that she would like to make a friendly amendment, she could do that. If you're going to treat them as separate items, you should probably amend your agenda to add a new item to discuss specifically masking. But if the discussion occurs now and it's just discussion, you can decide if you want to include that in the motion or if you would like to treat it as a separate item. But since you're in discussion now, you can discuss the question of a mask mandate, and then eventually, when you're done discussing, you go back to the original motion in the second.
so any more comments on the mask mandate for this?
And I don't want to change the motion with that. I just wanted to bring it up and was asked to do so, and by others in our county also.
Yes, go ahead.
Madam Chair, I appreciate your position, Commissioner Philby. I believe we should handle this separately, deal with the first item, and then we could have more discussion about a mask mandate if you want. My position might be a little different than yours, Commissioner Philby, and probably comes as no surprise, but I would think we should deal with one thing, and then we could have some discussion about the other if you would care to.
Is that okay with you, Lisa?
Sure.
Everybody else, is that? Okay. Okay, so then we'll call the motion for the first to rescind our previous, and all those in favor say aye.
Aye.
Those opposed, nay. Motion passed. Now we will add to our meeting a motion consideration regarding mask use for the government center, both employees and visitors.
So if you would, just for the minutes, then if you would have a motion and a second to amend the agenda to add item 6.7, discussion of mask mandate.
Okay. Can we have a motion to amend the agenda to add 6.7 to discuss masks?
So moved?
Motion's been made. Is there a second?
I'll second, Madam Chair.
Any further discussion? Seeing none, all those in favor say aye.
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 Those opposed, nay. Motion passed. Okay, so now we will consider 6.7 masks use practice.
Madam Chair.
Yes.
Clearly, I'm not for any sort of a mandate on masks. But I have felt for a long time that we do know that masks do some good. And in particularly, we know that the N95 mask is the one that protects you from others and others from you. And here we are in our second year, and N95 masks are not readily available to everyone who wants one. And even as part of Centric Care's numbers, when they put them out, they include what the effect would be if it was an N95 mask, the improvement. But yet we've been running around with all these fabric masks and homemade masks, and just for what reason is a little bit, it does diminish. I'm sure that it helps some, but it doesn't help a lot. If the county was to do something, I would rather see us provide some N95 masks to people who want to wear them, and that affords a protection to themselves and others, and not to mandate mask wearing to anyone that doesn't want to.
Madam Chair?
Did you, is that just a proposal or a motion?
That's just a thought.
Okay, okay. Just to clarify. Okay, go ahead.
Madam Chair, I think Felix has a good idea there in regards to working to acquire some N95 masks for distribution. I also think that we still have a lot of things that are in place for protection in regards to the barriers that are up. And we are not stopping anybody from wearing a mask if that makes them feel better or more protected. I don't necessarily agree with mandates. These are personal choices, and if our employees choose to take those personal choices in wearing masks, I'm totally supportive of that, and encouraging at the door that we encourage our visitors to do the same. But in regards to mandates, I struggle with that one, just because these are personal choices that people can make, and I will protect myself. Someone else who chooses not to wear a mask, that's their choice, so that's my thoughts.
Anyone else?
Madam Chair.
Yes.
I struggle with this one mightily. Obviously, I hate that we're in this position still as employers and elected officials in general. You know, we very obviously have the ability to reach out and, you know, be the parent and tell our employees and our visitors that they need to do this thing to help, that is very obviously backed by science, and we're sitting here threatening's not the right word, but deliberating, making a rule for people to just use some general common sense, and I struggle with that. I struggle that we're in the position. I wouldn't be in favor of mandating masks in the building right now where we're at. However, I definitely reserve to change that based on people's behaviors and where numbers continue to go. I think right now I just want to make sure that our employees and the general public understand all the information that is coming from us and coming from public health and is being shared by medical professionals. It isn't made up. It's very clear between vaccines, boosters, the types of masks and where to wear them. It's very apparent what the best way to handle things are if you want to avoid the sickness and having it be serious. And I would hope that, you know, if people are philosophically opposed to certain things, I understand that. People are in all kinds of different places on everything with this. It's been politicized. No one trusts anybody, and it's just a miserable position to be in. I feel like I'm banging my head against a wall for the last 12 months. And, you know, it's just a struggle. But the data's there. Be smart. Ask yourself if you can, you know, there's a lot of people that I've heard that, oh, it's just a cold or it gets sick. Ask yourself if you can afford to miss work for 10 days. Ask yourself if you can afford to get sick and go into the hospital. Quit making it some big philosophical deal. It's pretty plain. And I just ask our employees and visitors to be smart. It's not a fantastic hill to die on. So that's my 2 cents.
And I would be good, Madam Chair, with having that signage and having N95 masks available for visitors when they come in the building, and of course to our employees as well. I want everybody to be safe. The information is out there to absorb, and you choose to take it or you don't.
And to circle back around, I do like Felix's idea of making sure that we have the masks that are most effective as widely available to everybody that wants them as possible. I think that's a good step.
My thoughts is that having N95s available for people who want them would be very good. My one concern is that what my choice is affects you, and your choice affects me. So what I do doesn't just affect my health, it affects other people's health. And we know that this spike that they showed us is coming, and we're in the middle of it, and it hasn't gone down yet. We're hoping it will, but it hasn't. But we don't see the data yet. Everybody has some impact on other people with the choices that they make. So really, from my perspective, is that we need to think about the group, the public safety, public health, rather than just me. And so I would like us to consider asking that everybody wear a mask of some sort. And then if you want to wear N95 because of your particular health issues and concerns, we would have them available. But let everybody know that because we are public and we serve the public, we're concerned about the public, we want the public to be well. And I'm on another group called Towards Zero Deaths. That's a highway safety issue. To me, this is just the same thing, Towards Zero Deaths. It's a public health safety issue. And that we can't just say, well, I think I should or I shouldn't. We need to think about the welfare of the group that we are part of. And we see Sherburne County having people becoming ill in numbers we haven't seen before. We see deaths higher than they have been before. And the one rapid change for us to make that can alter that is mask wearing. So I want us to really think about if for a period of time until the peak actually goes down, that we would say everybody that comes here and works here wears a mask of some sort, and you can choose what type of mask you want. But that way, we would be serving the public that we're here to do and keep as many people safe as possible. That's just my perspective.
Chair. Just also, for me, I'm not wearing this mask today for myself. I've had exposures. We've all had exposures in the last week. If you're really honest, if you've been out in the public, you've been exposed. I flew on a plane a week ago. I bet a third of the people on that plane had the virus. So I'm doing this to protect all of you today. And for me, that's the difference. It's not, and that's what I wrestle with. Our staff have to come to work. And they're not behind glass or separated by glass. They're right next to each other in many situations. So that's what I wrestle with. Commissioner Heinem from Benton County said, I threw this out there to literally do what I can to protect our staff. And he said temporary, there's sunsets, I think, February 20th something. And he said 2 to 6 weeks. We are the public health entity of the county. We have employees that work right next to each other. I'm throwing this out here and just wanted the discussion for us to just have totally out of support for our staff and our residents.
2 points. One is just for process. There is no motion on the table. This is good discussion, obviously, and the board can elect to move it forward. Would just note that we do not have a supply of N95 masks. We do have a supply of KN95 masks, which are used in the jail with the COs. If that flavors the board's discussion, just want you to be aware of that. We're not sure, as it was noted earlier, that N95s are totally available, but we do have KN95s. The other thing is, should the board want to mirror the joint statement that we'll be drafting, we could do that for customers and employees, which would be to be mask encouraging, mask welcoming, and use that same tier, KN90 or N95 if available, KN95 if available, or other masking. So just a thought for the board, whether you do a mask mandate or whether you do an encourage/welcoming, I think we could mirror the joint statement with what you're talking about for customers and employees.
Well, I know at hospitals, most employees wear these kind of masks. Because I lived at Mercy Hospital for 10 days in December with my husband. So, I mean, N95s, I think, are appropriate for certain people. But for a lot of people, this is also a very good option. And that's fairly available.
Yeah, and as a quick point of clarification, I believe in CentraCare's video, the numbers they used were KN95s for the 80%. They weren't actual. I think they acknowledged that everybody didn't have access to N95s, but KNs were readily available. Amazon will get them to your doorstep tomorrow.
No.
Well, it wasn't quite tomorrow. I had to wait 4 days.
Well, Madam Chair, for me, the point of the KN95 mask, properly fitted, accomplishes me protecting me and me protecting you. And that's a decision that an individual can make.
And for myself, I understand, Madam Chair, what everybody is saying, but then again, everybody in this work environment that works with each other should be having those conversations in their departments. That's my feeling. Those are individual decisions, and it should be something that the departments have the conversation with and take that action without us having to mandate. I want all of our employees to stay safe, and I would assume all our employees want to keep each other safe. Knowing all of the information that is out there, I think that they will opt to make the right decisions.
Madam Chair, just a question for staff. Do we provide the KN95 masks for employees that want them and do the fitting on them at this point? Well,
No, we could, I mean, I think we can provide them. I don't know if we have the capacity to do the fitting. But depending on the board's direction, we could figure something out. It would take us a little bit of ramp up, yeah.
And the KN95s don't require to be fit tested, it's just the N95s that require that.
oh, okay, the KN does not. So if we have the masks, employees want them, we can give them to them.
And again, if we can find a supply, we can make them available to customers. And depending on the board's direction, we can do mask welcoming, masks encouraged, or we can say masks required. That's the topic here, so.
At this point, I appreciate the discussion. Obviously, I don't believe it's the appetite of the board to go to a mandate. I do think it's important for us to have this discussion right now. At this time, these are unprecedented times that we're in with this virus. And so I appreciate having the discussion. I'm not going to be making a motion. And I would just highly recommend at our department head meeting. I think the challenge of doing it department to department seems very chaotic and crazy out of respect. I mean, I think that could be even tougher. So I think that if the sentiment can be taken to department heads, that it's strongly encouraged, recommended, especially for these next 2 to 4, 6 weeks, with the data that we have out there, with what we know, and with the sentiment that it is the board's #1 interest to protect our staff as we're able to. So,
Madam Chair.
Yeah.
And I would agree with Lisa that we should mirror the message that we're sending to the public to within our own four walls as well. And again, one thing I want to make clear is I want people to know I reserve the right to completely change my mind, especially, what people seem to discount is the impact on workforce. If all of a sudden within these four walls, we're struggling to provide services to the public, the conversation is going to be a lot different, because at that point we're generally failing in our duties to the public, and then I think this board should take some form of action to rectify that if that time comes.
So 2 weeks ago when we had the conversation, I had suggested putting signs on the doors. You guys said, whoa, let's slow the train. What I'm hearing today, and I guess I'd like to know if I have consensus, or if you want to put a motion on the table, is that we would mirror our external message internally for employees and customers. And I would use phrasing like masks are encouraged, masking is welcomed, and then suggest masks and then have them available as we have them available, specifically the KN95s. And just a point, just as Commissioner Phobie mentioned, we do already have, I like the enterprise-wide concept. It keeps it cleaner. That way we can communicate it. But just so the board is aware, we still do have a separate set of requirements in our congregate care facility, AKA jail. So, but for all the other departments, if the board wants to say, yep, let's do that, then I have direction, I can do that.
How are you thinking?
Do
Want to make it formal, or do you want to make it?
I think I can take it by consensus or motion, either one, as long as I have it, because, 2 weeks ago, with all due respect, you guys said, let's think about this more. Now we have. But if there's 5 head nods, then this was a discussion and you've given me direction, yes.
And clarify what that direction is again for us, Mr. Mesa.
I am going to take the public statement that you had approved prior. I'm going to take that and modify that for a enterprise-wide statement, which are that masking is encouraged, and then the other 3 bullet points, as noted, about social distancing and good hygiene, would also be part of that for both customers as well as for employees, and that we will then list what we mean by masking, ideally N95 or KN95s, other masks if no other ones are available or medical necessity, and that we would also make those available to the public and to our employees. So then again, the phrasing will be that I like is masking is encouraged or masking is welcomed.
Can we put in there anything about the time period, you know, that right now we're really encouraging masks because of Omicron and the spike we've seen locally? I mean, can we do that?
Yeah, I mean, I'll work with Dave Unzi on the messaging. For signs on the door, it's usually pretty simple. Masks are encouraged. But I think for information, yes.
Yeah, because we want people to know that that's why we're encouraging this at this point.
Okay.
If there's a need, does that sound reasonable?
Yeah, I think with your door signage, it has to be pretty simple.
simple, yeah,
So,
that.
Yeah.
but I think if we give the similar message to our staff that we're giving to our public, that's going to carry, through, mostly for me, it's about protecting staff and the public.
Yeah.
in
Did
that.
I summarize that for you, Commissioner Schmeesing? You got the gist of it?
Masks are encouraged.
Okay.
Yeah.
Thank you.
Okay. So, now we have, that was 6.7, and
You're up to item 7, Commissioner Correspondence
Yeah.
Committee Reports.
so Commissioner Correspondence, anybody ready to go?
I could go, Madam Chair.
Okay.
January 6th, attended the 2021 legislative breakfast. Also attended Deputy Tim Janetta's retirement party, January 12th. And Lisa, there was cake.
Darn.
January 12th, solid waste advisory meeting. And January 13th had a ATP transportation partnership meeting. And then that evening had an APO meeting in St. Cloud. Just wanted to, there was a discussion that came up at the APO meeting in regards to the chair was asking if the APO wanted to weigh in last year because of the funding that came down for the 169 and Highway 10 project, and then, of course, the 94 project in St. Michael, Albertville that got funding. There was a lot of pushback from Greater Minnesota, feeling that they feel that that was like more should have been metro area. And so the APO, the chair was asking if the APO should weigh in on should we be looking at different ways to do this funding formula based on the feeling that the collar counties around the metro, Greater doesn't really view them as Greater. And I did acknowledge, but Metro doesn't view us as Metro. And I said that this is, tough. I said, I hope we're not looking to make a statement for one snapshot in time. So we'll see where that goes. They are going to look into it and see about having a conversation with how this funding could look. And we'll see where it goes. I did ask them not to kick us out of the family. That was it for me.
We are neither fish nor fowl. Well, maybe a little fowl some days, but. I don't have anything, Madam Chair.
Okay. Go ahead.
I had the Rum River One Watershed One Plan meeting. That is progressing, thank goodness. Sherburne County area townships, we had a skeleton crew due to lots of COVID outbreak in townships, and but it was a good meeting. I had the MICA meeting, the Soil and Water meeting, TRICAP executive meeting, and Central Minnesota Jobs and Training Government Relations meeting, and the Central Minnesota Jobs and Training Workforce Development Board.
Okay, is everybody else?
Madam Chair, I had the legislative breakfast, retirement party for Deputy Janetta, and also sat in department head type presentation from Google Workspace to department heads and some other miscellaneous members. And I think that is I might make some corrections when my computer works next meeting.
What
What percentage are you at?
It is done, but it is not connecting to anything, so,
Gotta love technology.
yes, indeed. That one's a Microsoft issue.
I went first, so.
So then, the legislative breakfast, retirement for Tim, a CAMI meeting, and then the River One Watershed One Plan meeting, and the Solid Waste Advisory Committee. I wasn't able to go to SCAT, and then SHAC Executive Committee, and that's it.
Madam Chair, I think one of the townships has sent a letter to the SCA, it is SCA, right? Sherburne County Association of Towns, SCAT. Yes, thank you. Asking that maybe the meeting go back to the third Wednesday, because I know Big Lake couldn't make it because the meeting went long. Barb and I couldn't make it because they happened to schedule, and then, of course, one of the other commissioners that's the chair of that board couldn't make it either. So hopefully they'll consider that, and it won't be such a conflict with some of the townships.
Madam Chair, one thing to add, because I know Felix and Lisa couldn't make the legislative breakfast. One key thing that I wanted to make sure I passed on to you is our state representative Novotny kind of pointedly asked us what we wanted him to do in regards to North Star, and let us know that, you know, he's willing and able and ready to have those conversations when we have more information. What we relayed is we didn't have enough information to give him any direction at this point, but he is looking for that feedback from us as soon as we're able to give it.
In a broad sense, we probably have plenty of information for him. So,
Okay. Any other? Seeing none, then we will move on. We will close our board meeting and open our workshop meeting.
If the board's willing, maybe we could have a few minutes break. And then also, Dave is going to bring pretty much his whole staff. So for the first item, for sure, if the board's comfortable, we'd like to do the workshop in this room, just because it'll get crowded in there with board and all the staff that he's bringing, so.
Sounds
But
good.
maybe a 10-minute break real quick?
Okay, sure. We'll be back at 10:40.
Perfect.